Hi and hello, I am Athena Pandin here. Welcome to the Biomedical Equipment Training online mode. So here in this class, passed on, we are crossed over some of the basic equipments, medical equipments and everything. Now we are moving to one more basic medical equipment that is used in the ENT department, that is called as an ear, nose, throat. So in that, the most important equipment, especially for viewing the internal organs of the ear, we are going to use a special scope. It is called as the otoscope. So otoscope, of course, if you know that otology is the study of the internal or the anatomy or the function of the internal organs of the ear. So in that way, scope is nothing but otoscope is nothing but we can able to view the internal, middle, and the internal parts of the ear using the scope. That is called as the otoscope. Okay. So what are all the parts inside in the, what are all the parts on the otoscope, and how we can able to use it, and what is the purpose of that particular otoscope? All these things we are going to discuss today. So come, let me start the topic, start the demonstration now. And before that, I'm just going to give some of the description about the otoscope and what are the things required to do before the taking the otoscope measurements, all the things. So what is the purpose of using otoscope is, for example, if any of the patients have ill effects in the ear, in the human ear, or it can be, or else they have a pain over the internal ear or the middle ear, they consult the ENT doctors. The ENT doctor straight away, you just get the information about, get the clarification about what are all the things you are used while you are disturbing your eardrum or not. All these kind of queries they may ask. Once he answered all the, once he get all the answers, and then he used the equipment called otoscope, the basic equipment called the otoscope initially. So once he took up that particular otoscope, he is supposed to view the particular internal ear through that particular otoscope. Okay. Then he may to identify what is the condition of that is. Okay. So for the purpose of knowing the exact condition of the, in particularly condition of the eardrum or the tympanic membrane, we are supposed to use this particular otoscope in a way. Okay. And then this particular otoscope are many types, of course. I will show you the slides. Once you have gone through all the slides, you can able to clearly about further clearance about the otoscope model. Okay, of course, I will share my screen now. So this is the otoscope we are supposed to look. So what is otoscope is? Okay, what is otoscope is? Of course, I already told you, to viewing the internal organs, to viewing the internal organs of the human, internal organs of the, especially in the air, internal parts and internal construction, all the things we can able to see using this particular otoscope. Okay, then before you are going to see that particular, using that particular equipment, the small description about the internal ear. And this is a very important thing, because if this is external ear, this is the ear canal. Actually, this particular ear canal is cross 10 centimeter. That is the thing, especially for attenuating the sound energy, that is sound frequency from the external to the internal. That is what we have the certain distance between this particular outer ear and the tympanic membrane. The ear canal pathway is especially for attenuating your sound frequency. Okay, that particular thing. And then after that, we have the tympanic membrane and the, or we can able to call as a tympanic membrane is also called as the eardrum. And then we have the ossicles, and then we have cochlea, and then eustachian tube. All these are the major parts of the human ear. Okay, if there is any fault or if there is any feel of illness in that particular area, we are supposed to use any of the equipment to know, because these are all the internal organs. Actually, we can't able to see using our naked eye. So that is why we are using this particular otoscope equipment. Okay. So this is the look of the tympanic membrane, what you are going to see through the otoscope. Once you look over the otoscope, to the through the outer ear, you can able to see this particular shape of the tympanic membrane. Okay. Just see. So a small clarification. The healthcare providers uses otoscope to screen for illness during irregular checkups and also to investigate ear symptoms. Whatever the symptoms it may be, the first checkup the doctor may be used to diagnose using this particular otoscope. Okay. See, an otoscope potentially gives a view of the ear canal and tympanic membrane or eardrum. Okay. The presence of earwax, that is called as a cerumen in medical terminology, then shirt skin, pus, canal skin edema, foreign body, and various ear diseases can obscure any view of the eardrum, and thus we severely compromise the value of otoscopy done with the common otoscope. Okay, these are all the things will close to view the structure of the particular eardrum. So for that particular reason, this otoscope may be very useful for you to view the eardrum or the tympanic membrane. Okay, that is what they mention about. This is the look over of this otoscope. This is the otoscope actually. The thing that is in the tip of that, it is called as a speculum. Speculum is a terminology that is especially for viewing the internal organs of the human body. In this particular area, we are using this particular speculum for viewing the internal ear and the middle ear. Okay, so especially eardrum or tympanic membrane. These are all the other speculums are there because each and every speculum having a different sort of diameter at the tip. Because each and every one's ear canal diameter is entirely different. So according to the person's diameter of the ear canal, we can able to use this particular that is a head, that is a speculum. Okay, it is a changeable actually. The three important parts there in this otoscope. One is the battery compartment. We can able to put a battery in the bottom. I will demonstrate. No problem. Each and every parts I will explaining through the demonstration. You can able to see very clearly. Just see the theory of what has happened. Yes, we can say this is the light and this is the head. In the head, we have a magnifying lens, and the tail we have a battery compartment, and the operations for on and off. The light can able to on and off through the this particular tail switch only. And then we have the speculum. Of course, I told you. These are all the small parts of the that is otoscope. This is the another look. You can able to view this particular thing. Okay, this is another view, and then this is the way we can able to use the otoscope. We can able to place the thing into that particular region. This is the image that we can able to see clearly. Okay, so this is the types of otoscope we are supposed to use here. So I will show you again. I hope it is running very fastly. Yes. Yes, this is the way we are supposed to use the otoscope. We can able to place that particular speculum into the air canal. Through the air canal, we can able to give the LED light. That is, the LED light is also there in this particular head region. That particular LED light will be send the light intensity to the particular eardrum. Then we can able to see the particular eardrum very clearly in the magnifying lens. Okay, magnifying lens is seen in the straight opposite to the speculum area. Okay, so this is what we can able to use the otoscope in a proper manner. I think yes, this is the way. And this is the otoscope categorized. It can able to categorize the otoscope into three different types. You can able to say that is called as a pocket otoscope, full size otoscope, and video otoscope. So pocket otoscope we can able to keep it in the very portable actually, and then the full size otoscope is nothing but in the magnifying lens. No, in the magnifying lens we have the large size monitor there, as like your phone screen. The phone screen size will be showed, it will be placed over in the magnifying glass. Then you can able to see the particular eardrum very clearly in the magnifying manner. We can able to keep. Okay, or in the way we can able to say, we can able to connect this particular otoscope through the data cable into your mobile phone, and through the mobile phone we can able to see what has happened in the internal ear, what is the view of the internal eardrum, all the things we can able to see through the phone itself. Okay, that is called as the full size otoscope. And then video otoscope. So video otoscope is nothing but we can able to look at that particular thing into the CPU, and we can able to record it what is happening inside the eardrum and all we can able to show. Okay, these are all the different categories of otoscope we are supposed to use. And then now it's a time to say thank you for this particular equipment. I'm going to demonstrate. Okay, straight away I'm going for the demonstration, and you can able to clearly understand about how to use it and what are all the parts available and what are all the purpose of this particular each and every parts, all the things which I will explain you very clearly. Okay, go and see the particular thing. Thank you very much. And welcome back to the demonstration of the otoscope now. So now I am going to give you the demonstration of this particular otoscope. I already crossed over the theory part of the otoscope and what is the purpose and what are all the types and how we can able to use the otoscopes and all. So now I am going to demonstrate you how we can able to use this particular otoscope. Okay, so this is the equipment model. We are supposed to use the brand is Pulse Autoscope. So Pulse is the model. So we just brand, and this particular otoscope is going to be look. So these are all the speculums. So speculums are nothing but the common medicine term for the speculum is if you want to see any of the internal organs or internal objects, the equipment that are used or the small device that are used for viewing the internal organs are called as the speculum. Okay, so in that way these are all the 6 different speculum. 1, 2, 3, 4, 5, 6. These are all the 6 different speculums we are supposed to use here in this particular otoscope to view the internal organs. At the same time, this particular thing can able to replaceable actually. So according to what is the need of this particular 6 different size is the dimension of the hole. The dimension of the ear canal is entirely different for persons and persons. So that is why we are just to have these different things. Okay. At the same time, this can able to use it for pediatric also. At the same time, this can able to use it for the obese patient also. So because of that only we have these kind of dimensions part and everything. So now I am going to open this particular package, that is otoscope equipment. So this is the device that is called as the otoscope. Okay, so this is what I am saying, and these are all the speculums, and these are all the 2 batteries. And just open this particular thing. See, this is the otoscope. This is the otoscope. There is a handheld device. It is very comfortable. It is very portable. We can able to use this particular thing in the home itself. Okay. So this is the small device. Using this, we can able to see the internal objects. Here I am just say the parts first of all. So this is the battery compartment. This is the battery compartment. We can able to put the battery here, and this is the illumination light on off. Here in this particular magnifying lens, we have the illumination light. So that particular illumination light only give the clarity about what is present inside the internal organs. Okay. So this is the thing giving the illumination on and illumination off can be able to done this. And the third part is magnifying lens here. This is the magnifying lens. The whole part we can able to call as a headpiece. The whole part, this particular whole part is called as the headpiece actually. In the headpiece, the first part is magnifying lens. So here through this only we can able to see this. Some of the other otoscopes are also there. That is called as the full size otoscope. Instead of this particular magnifying glass, they are just fixed a large monitor as like as our mobile phone. That particular mobile phone size, the magnifying glass is fit over this. Through that we can able to see the enlarged image of the particular internal organs. Okay, so this is the headpiece. I repeat, headpiece. In the headpiece, the first part is magnifying lens, and this is the speculum. Okay, we can able to remove this particular speculum also. Yes. See, we can able to remove this particular speculum. Once we are removing this particular speculum, we can able to see the lights, LED light. So this is the LED light actually. Through this only the illumination will come. Okay, I will show you how to use this. So first of all, I just need to put the battery here. So first of all, I just put the battery here and then I use whether this particular thing is functioning or not. This is very comfortable and very sorry. So this is the nothing there in the common electronics or nothing there in this particular thing, because it is very comfortable and very portable thing. You can able to use this particular thing for the manner of yes. So here, once you are inbuilt the particular battery inside it, then this particular LED light will glow. This particular LED light will get into the ear canal to show the internal organs through this particular magnifying lens. Okay. Now I will just go to use this particular. This is the headpiece. We can able to use this particular thing to fix like this. Okay, so this is the way we can able to fix it. So through this thing you can able to view the internal organs. So how we can able to use this particular thing is pass. He's our trainee. Of course, you are all well known about his name as Abdul Bashir. So he gave so many training to you. So I just use this particular Abdul Bashir as a patient now. So I am going to see the internal organs, that is especially the eardrum or tympanic membrane of patient. Okay, you can able to use this particular thing. The most important thing is this particular speculum is cone beam. It's a cone shaped actually. Reason behind this, it can give the cone beam structure. Through this, because of this particular nature only, we can able to enter this particular size into the ear canal. So that is why we have the cone shape or cone beam shape like this. So we can able to use this particular thing. The most importantly, you should not be touch the internal layer of the internal that is the ear canal. That is a very important thing. So most importantly, you just look over this. See, you can use this like this, and you can clearly see through the naked eye also. We can able to see the eardrum of the patient clearly. Okay, so this is the way we can able to use this. So very simple equipment, very simple and moderating equipment. This gives much advantage because most probably it is used in the ENT department. Is nothing but a ear, nose, throat. That particular department, in particularly the ear, for the diagnosis of any illness happen in the ear, the first equipment, the first basic equipment they are supposed to use is this particular otoscope. Okay, the study of internal organs of the anatomy and physiology of the internal organs of the ear is nothing but otology. Because of this, we are using this particular scope. That is why it is called as the otoscope. Okay, so this is the demonstration of the small equipment, that is otoscope. These are all the other speculums we are supposed to use. These are all the other speculums according to the size of the person's ear canal dimensions. We can able to use a different speculum size. We can able to see. I will show you. See, we can able to place the different size of speculum here. Please remember the term speculum is very important terminology. So through that, you just see the opening dimension of the opening of this particular canal. The diameter of this particular thing is entirely different. The size of speculum is almost same, but the diameter you can able to look over in the edge part is entirely different. Okay, each and everything have some of the different diameters in the end part. According to that only the light will be illuminated over the internal parts. Okay, so this is the small description of this particular otoscope. I hope you understand about what is otoscope and how we can able to use it. So there is no need of any much amount of installation process as like as other process like you can able to go for the ultrasound physiotherapy unit, or you can able to go for the fetal doctor like this. There is no electronic components inside. Only the small LED light is there. You can able to fix the particular speculum, and we can able to use the magnifying glass. We can able to see the internal organs very clearly. Okay, so there is no much of demonstration, and there is no much of dismantling and all. So I hope so you can able to understand very clearly about the otoscopes. And thanks a lot for listening this. You will see the next video with the next important equipment used in the hospital.